folks here are nursing homes that have previously participated. Thank you for your previous participation. Okay. So hello and welcome to WisCaregiver Careers Employer Recruitment Webinar. My name is Kate Badiato, and I am the WisCaregiver Careers Project Manager for our 2021 relaunch. I'm also the Director of Workforce Development for the Wisconsin Healthcare Association and a Career Development Facilitator. I've been working in the field of workforce development since 2012, and I'm so excited for the opportunity to be involved with the CNA workforce development scene here in Wisconsin. With me today is WisCaregiver Project collaborator Robin Woldenberg, who is also the Director of Housing and Clinical Services at Leading Age Wisconsin. Hi, Robin. Thank you so much for being here.
Hi, thanks for having me, Kate. Hi, everyone.
Great. We also have Margaret Rosenthal, who is a Senior Project Coordinator at the Wisconsin Department of Health Services. She is with us today to explain one of our best enhancements for our 2021 relaunch, which is our new partnership with the Food Share Education and Training Program. Welcome, Margaret.
Thanks, Kate. Glad to join you.
And last but not least, we have Kevin Coughlin, who is an Executive Policy Initiative Advisor at the Wisconsin Department of Health Services. Those of you who participated in our first pilot may remember Kevin for his excellent work in getting WisCaregiver Careers off the ground. He has been equally wonderful in helping to transition this program from DHS to WHCA and is with us today to help answer any questions you may have. In fact, Kevin will be staffing our Q&A box throughout today's webinar. So if you have any questions as we go along, please feel free to type them into the Q&A box on your screen.
Thanks, Kate. Really excited to be here today and really to get this relaunched and a little bit, hopefully a better product as we move forward. So thank you very much for having me.
Great. Well, we're happy to have you. So here's an agenda for today. Our goal for today is to build or expand upon your understanding of what WisCaregiver Careers is all about, and for you to understand the roles and expectations for employers. We'll walk through a program overview, then provide details on a new program feature for 2021, our new partnership with FSET, and then we'll cover all of the highlights of our contract so you know what's expected of WisCaregiver employers, and then we'll end with Q&A and your comments on any lessons learned. We're very interested to hear from any of our previous program participants so that we can build upon our past successes. So here's a quick program overview. WisCaregiver Careers is a workforce development program designed to address the CNA shortage in Wisconsin nursing homes by providing free training, free testing, and a $500 or more 6-month retention bonus. The program seeks to encourage new workers to enter the field of caregiving by lowering the cost of becoming a CNA and by making training more readily accessible. The program pays for the free training and testing while employers pay for the retention bonuses. The 2021 relaunch of WisCaregivers Careers is being administered by WHCA, the Wisconsin Healthcare Association, in partnership with DHS and Leading Age Wisconsin. The program originally launched in March of 2018 as a grant-funded policy initiative out of the Department of Health Services. When changes to the program's funding stream made DHS ineligible for further grants, DHS reached out to WHCA and Leading Age Wisconsin to become the new grant applicants and program administrators. WHCA and Leading Age Wisconsin are both nonprofits which represent long-term care providers across the state. DHS is still a cornerstone project partner and has been integral in getting our relaunch organized. A big thank you to Kevin Coughlin and all his colleagues at DHS from the Division of Quality Assurance and the Food Share Policy section for all that you have done and continue to do to make this a success. WHCA is taking the lead on program administration, and we administer the program's finances through 2 separate grants. We were awarded a $400,000 Wisconsin Fast Forward grant by the Wisconsin Department of Workforce Development this summer, and currently have an application pending with the Civil Money Penalties Grant Program, which is administered by the Centers for Medicare and Medicaid Services. Thank you to the Board on Aging and Long-Term Care and the Wisconsin Technical College Systems for supporting our grant application, and thank you to the Wisconsin Department of Workforce Development for the grant. So in addition to administering the program's finances, WHCA functions as a hub between the various program stakeholders. As you can see from this list, there's a lot of moving parts. It includes our program participants, FSET, like I mentioned, our training consortium, the people who provide the training, the CNA testing provider, nursing home employers, you all, and overarching it all is the UW Oshkosh Center for Community Development and Training. So here's a visual overview of how the WisCaregiver Careers Program works. One thing to note is that our student data tracking system and the automatic email communication that it facilitates occurs throughout the process. So as you can see, everything starts with FSET. As we'll hear in more detail later on, FSET will be doing our program recruitment, screening, and intake. They will also be there to support WisCaregivers throughout the training to employment pipeline by providing case management services. So once WisCaregivers are signed up for the program, FSET will refer them to the training providers who have signed up to be part of our WisCaregiver training consortium. The next step in the process is getting students to the certification exam. Training consortium members and FSET will work to help students successfully take the test. The WisCaregiver will also receive automatic emails from our student data tracking system, prompting them to sign up for the test. So once the WisCaregiver passes their test, they move on to the employment at one of our participating nursing homes. And after 6 months, they receive their bonus. So one of our program features for our 2021 relaunch is revamped videos and marketing materials. So we will be producing 4 different videos targeted towards the WisCaregivers to encourage careers in as a CNA. The topics that we'll be including cover the value of becoming a nurse aide, highlighting a nurse aide career as a stepping stone to progressive careers in healthcare, a quick video on the free training, free testing, and $500 retention bonus offered by WisCaregiver Careers, and finally details on how the program works and each step of the process so that WisCaregivers can fully understand what the expectations are. Also, we'll have create videos for FSET providers and our employers to show the roles and responsibilities of the program. So a bit about FSET, like I mentioned, Margaret's going to be going into further details, but just so that you've got a base of knowledge to go from, FSET stands for Food Share Employment and Training Program, which is a free program that helps Food Share members build their job skills and find jobs. And they'll be doing the program enrollment, screening, and recruitment, and they'll be using our marketing materials to help in that. And the really valuable aspect to it that we're really looking forward to is the case management support provided to the WisCaregivers to help them through the process. So here's a bit about our WisCaregiver Training Consortium. It's also administered by WHCA, and the Wisconsin Technical College System is one of our cornerstone partners. We've also had some private training programs sign up, and we're also putting a new emphasis on in-house training providers. So for any nursing homes who may be tuning in right now, we want to encourage you to join the training consortium if you haven't already. If you have an emergency nurse aid training program, it might be a good opportunity to think about starting a permanent program. The main feature here is that we offer a $655 reimbursement for each WisCaregiver trained. One thing to note is that we currently have funding for 500 training slots that will be filled on a first come, first served basis. We'll be in communication with our training consortium about availability of training slots as we go along, but we are encouraging our training providers to act quickly and be organized quickly so that they can take advantage of as many slots as possible. Now, one thing that we are interested in is our employers, partners' capacity to hire. And so right now I'm going to launch a poll about asking you all about your hiring capacity. If you could quickly fill out this poll to let us know about approximately how many CNAs your nursing home would like to hire through WisCaregiver Careers, that will help us get a feeling for the type of the demand that is out there, and will help us work with our training partners to understand how quickly the trainees will be able to be placed upon certification. So I'm seeing about 75 answers coming in. About half of the attendees have voted. Again, we're looking to know approximately how many CNAs your nursing home would like to hire through WisCaregiver Careers. And I'll leave that open for about 5-10 more seconds. So if you haven't gotten a chance to vote on that, if you could please put through your answers, that will definitely help us in our planning. We appreciate the information. And if you're not sure, you can always fill in the don't know button and can follow up with me later if you get a better number. So thank you all. I'm going to end the polling and I'll show the results so you all can kind of get a sense of what we're looking at. Looks like most folks are looking to hire between 11 and 20 CNAs. All right, so moving right along. Another aspect of our 2021 relaunch that we're really excited about is the training program support that we're able to offer. Our 2021 relaunch is also helping to implement a key piece of COVID-19 specific legislation pertaining to CNA training. On April 15th, 2020, Governor Tony Evers signed legislation to address the COVID-19 pandemic in Wisconsin. One provision of the legislation reduced the minimum number of training hours for CNAs from 120 hours to 75 hours, which is the standard provided under federal law. To help support the implementation of this new regulation, WHCA and Leading Age Wisconsin want to connect with any training programs or other stakeholders who are considering using the new rules to create or modify CNA training programs. You see here that we've put forth some ideas that we're currently considering, but we are very interested to hear from you as to what would be most helpful. So you can use our after webinar survey to share your ideas with us, or give us a call or email to get started. So here's the WisCaregiver Employer Consortium in a nutshell. It's administered by WHCA. The key provisions that members agree to are to track some data and retention bonuses, to provide that 6-month retention bonus. And one important thing to note here is that the Employer Consortium is only currently available to nursing homes in Wisconsin due to limitations from our CMP grant funding. That program requires that any funds need to benefit the nursing home provider community. So that's why it's currently limited. On this note, I would like to poll you all on your current practices regarding retention bonuses. We're interested in knowing what amount, like if you're doing it, and and the amount. So I'm going to launch this poll really quickly. And if you could be so kind as to share those that information with us, we'd really appreciate it. So it looks like of the folks who are offering retention bonuses, all are offering it at the 500 or above level. Right now I'm seeing results, 41% do not currently offer CNA retention bonuses. About 75% of you have voted. So if you could, please let us know if you're offering retention bonuses. If you don't know if you don't currently offer, or if you do not know if you offer bonuses at this time, you can always click the I don't know button, and that will help us get a clear picture. So thanks everybody who voted. I'm going to end the polling and share the results. So yeah, like I mentioned, looks like of those who are offering a retention bonus, most are offering at the $500 level, which is great. Okay,
Hey, Kate.
thank you. Thank you
Kate,
for the information.
can I interrupt just a minute?
Of course.
We have some questions about, I think there's some misunderstanding about the 75-hour program, some thinking it's only through the emergency period. Do you have, did you want to just share a little bit more about the 75-hour program?
Definitely. So yes, there is an emergency nurse aid training program right now that is a 75-hour requirement. Right now, or under this legislation that was passed on April 15th, 2020, the minimum number of hours for a training program, a permanent training program, went from 120 down to the federal minimum, which is 75 hours. DHS just hosted a webinar yesterday explaining how there's going to be a new application process for training providers to go through to get their shorter hour program approved. They did record that webinar and said that it would be made available on their website. So I would encourage anybody who might be interested in starting their 75-hour permanent program to check that out. The training program support that we are providing is designed for programs, especially in-house training providers, to create permanent programs. WHCA and Leading Age Wisconsin, I'm sure, would be more than happy to provide customer service support for any of our members who are interested in getting started with emergency nurse aid training program. But the training program support from WisCaregivers is really meant to try to help folks move either from a emergency program into a permanent program, or to get started on an emergent or a regular permanent program after the emergency is finished. Does that cover everything, Kevin? Is there any more that I might be able to explain more?
I think that's good for now. I will, there's some back and forth about this issue, and I'll try to take it offline with to help. I'll get some additional information. Thanks.
Okay, thank you, Kevin. So yeah, like I said, Kevin is just super helpful on everything when it comes to WisCaregivers, so we really appreciate his help. So here's a little overview of what the timing for the program looks like. We are, between now and March of next year, we're going to be really working hard to get the program organized. So we have already gotten the ball rolling with organizing our training consortium. We'll be working to organize our employer consortium, make some computer upgrades, and by March of next year, we'll be ready to open up those training slots. Between the second and third quarters of 2021, our main focus is going to be getting the 500 WisCaregivers through training. We expect to start tracking our employment outcomes, specifically the 6-month retention bonuses, starting in the fourth quarter of 2021 and into the first quarter of 2022. And we expect to have all of our grant administration and reporting wrapped up by June 30th of 2022 in compliance with our Wisconsin Fast Forward grant contract. So here's our minimum program outcomes that must be attained to comply with our grant requirements. We, of course, would love to see all 500 people who start the training complete it and move on to certification and employment. But these are the bare minimums that we can guarantee will happen from our program. So we'll see folks moving through the program that way. And then last but not least, we do have some program evaluation planned. We have a collaboration with the La Follette School of Public Affairs set up at the University of Wisconsin-Madison for a group of students to conduct a cost-benefit analysis to be overseen by experts in the field. We'll also ask our training program and employer consortiums to complete a program evaluation survey. And this information will be used not only to help us continuously improve the program, but also hopefully to demonstrate the value, the societal value of the program, which would help us have evidence for future grants and data to support our application in the future, because we would like to keep this program going for as long as we can. So with that, I'm going to pass it over to Margaret Rosenthal from the Department of Health Services. Thank you so much, Margaret, and go ahead and take it away.
All right, thanks, Kate. First, I would just like to say thank you so much for taking time out of your busy day to join us and to learn more about the FSTEP program. As Kate mentioned, I'll provide a little background about the program and really talk about some of the key components that are exciting to this project and that will really help out with the success of this program. So next slide, please. So basically, FSTEP is a free employment and training program. It really focuses on the strengths, needs, and preferences of people looking for employment, and it provides a comprehensive approach to helping to build plans for employment and plans that will lead to successful careers and livable and jobs that pay livable wages. Next, please. The next slide, this is a map of how the FSTEP program is operated in Wisconsin. As you can see, it's operated by different agencies in 11 of our regions, and then we also have 8 tribes that participate in providing FSTEP services in our state. Perhaps some of you might be familiar with some of the names on that slide, just right along the side there. So who can enroll in the FSTEP program? Basically, anyone over the age of 16 that's receiving food share benefits through the state of Wisconsin is eligible to enroll in the program. That means high school students could also be part of this exciting project. Next, please. I'll take a little bit of time to highlight some of the services that are available through the FSTEP program. And as Kate mentioned, you know, the real core assets, I think, is that FSTEP is going to be able to help you recruit screened applicants and provide case management and follow-up services to hopefully make this program a huge success. So initially, when someone enrolls in the FSTEP program, Their strengths and needs and barriers to employment are assessed by the case manager. The case manager uses that information to work with the individual to develop a plan to provide some of these other services. That can mean education. So in this situation, suppose someone's interested in CNA training, but they need to brush up on their math skills or basic literacy. EFSET can provide that educational training to help them build their skills so that they'll be able to attend the training and then later become employed as a CNA. And throughout the job search component of EFSET, individuals receive help with interviewing skills, with their resumes, work on soft skills training, so that when they do become employed, they have just more assets in their pocket to help their job become successful. Another exciting component of EFSET is the job retention services that are available. Once someone becomes employed through the EFSET program, they're able to receive up to 90 days of follow-up case management. Case managers track the individual to make sure that they're succeeding on the job, if there's any barriers that come up, how they might be able to help that individual and address those. Oh, sorry, I'm seeing something pop up on my screen. Okay, next slide, please. And the next slide basically talks about, as I mentioned, the value of case management services. And that's an ongoing service from the beginning, the time the person enrolls in the program, throughout job retention services. And another important aspect of EFSET is that EFSET is able to help individuals pay for supports that they need that are reasonable and necessary to obtain and maintain employment. So sometimes an individual might have, until they get that first paycheck, they're feeling strapped and they don't know how they're going to be able to get gas in their car to come to work. EFSET can help with that. As far as uniforms, scrubs, shoes, and finding childcare, if that's something that individual needs, EFSET can also help that person link up with childcare providers and pay for childcare if they're not eligible for receiving free childcare services. Okay, next slide, please. I believe, oh, here we go. Okay, so why would you want to collaborate with EFSET? Why would you want to be a partner in this program? Well, you really have easy access to a pool of individuals that are interested in becoming CNAs. So you know that while you're working with the EFSET program, case managers are going to pre-screen individuals. They really want to see their participants succeed. So they're not going to put forth an application with someone that they don't feel they really have the aptitude and potential succeeding in a CNA position. And then the ongoing case management throughout the process. The case manager can also be someone that employers can speak with if need be, if they're seeing things that perhaps the individual would need to work on more. It's a true key component to this project. And then again, with the transportation assistance and the 90 days of on-the-job follow-up, it's something that the previous program didn't have, and I think it'll be a real benefit to this program. As far as enrolling in the EFSET program, if someone comes to your door and, can we go to the next slide, please? And they're not enrolled in the EFSET program, they're able to, you would recommend that they apply for food share benefits to become enrolled in EFSET if they're not receiving any food share benefits. And at the end of this slide presentation, there's some links where individuals can find out how to apply for food share benefits and even apply online. If someone is receiving food share benefits and they come to you and they say they really want to be a CNA with your nursing home or your organization, then Oh my goodness, did I lose my connectivity? I'm sorry. Hopefully you can still see me and hear me.
We can still hear you, Margaret.
Margaret, we can still hear you.
Yes, I think I've lost my internet, pardon my internet, so I'm speaking through my phone. And so I think I was basically saying that if someone was already receiving food share, they should contact their FSET, they should contact the local FSET agency and ask to be referred to the program.
And now we're showing the page with the resources, the different websites.
Right, so I believe I have a link for more information about the FSET program in general. And then there's also a list of agency contacts for each of those regions that you saw on the map that was in the beginning of the presentation. And then there should be a link for, it's a online application called Access, and it can be used 24/7. Someone can click on that and they can apply for food share benefits, medical assistance, and learn more about other benefits that are available to Wisconsin. So that's kind of all of it, just kind of wrapped up in a nutshell. Are there any questions at this time? I'd be happy to answer them.
We are looking now.
Yeah, nothing related to the FSET program at this time.
Okay.
We do have, there are some questions related to clinical sites. Kate, you and Margaret, or Robin have times there's concern that maybe there won't be enough clinical sites available for training. Do you have any response to that?
Yes, at yesterday's webinar that was hosted by the Department of Health Services, the Division of Quality Assurance, that topic was actually discussed a bit, and I was able to ask if training programs, so say like a technical college, a training program that was not an in-house training program, was having a hard time with a clinical site, I asked, could a training program partner with an employer to have the employer hire the student nurse aides as employees? Would that help with the barrier to the clinical site access? Because once somebody's an employee, they are not subject to the building limitation restrictions. And so that, and then the Therese Van Mail, the woman who runs the nurse aid training program from DHS, said, yes, that's exactly what the emergency nurse aid training program was all meant to be. So a private training program could partner with an employer as long as there was that employment agreement between the students and the employer. They would not be subject to those building restrictions. Does that help? Kevin? Okay.
Yep. Thank you very much.
Great. Okay, so moving right along, we just want to cover some contract highlights so that everybody here on the webinar today has a good understanding of what's asked of them as part of their participation. So here on the slide are the main responsibilities that WisCaregiver employers need to be aware of. These are all clearly outlined in the program terms and conditions that I will be sending you after you complete our registration form. So first off, we are required by our Wisconsin Fast Forward grant to secure formal letters of commitment from our employers. In order to be accepted by the department, the language must be very specific. So we ask that you simply fill in the template with the number of CNAs that you would like to hire from WisCaregiver Careers and the starting wage you typically offer an entry-level CNA. Then simply copy over the template onto your letterhead, and have it signed by an employee who has authority to hire. Okay. Second off is, like I mentioned before, one of our key program details is for employers is the 6-month retention bonus. We'll go into greater detail about this on our next slide. Also, our data tracking, as previously mentioned, we're asking employers to complete 2 short surveys to help us track the program's progress and also to comply with our grant requirements. I'll go into greater detail on this as we go along. And we will also cover this in very good detail at our implementation webinar this spring. Finally, we ask that you complete a program evaluation survey at the conclusion of the program to help our efforts at refining and improving programs. So here's all you need to know about the retention bonus. As I mentioned before, the 6-month bonus is one of our key program features and employer responsibilities. Here are some important details. First, WisCaregiver employers agree to pay WisCaregivers a retention bonus if they work part-time or full-time for 6 consecutive months. For the purposes of this program, full-time is defined as 32 or more hours per week. Part-time is defined as 32 hours or fewer than 32 hours per week. It's important to note that the program does not pay for the retention bonuses. By participating in the program, the nursing home agrees to pay the bonus. Finally, in the interest of fairness, we ask that you provide the same amount of retention bonus to WisCaregivers as you would any other CNA hired at the same time, with a minimum still of $500. So for instance, should you provide the if you're offering a $750 bonus at the time a WisCaregiver is hired, you should also provide the WisCaregiver the $750 bonus. They shouldn't lose out on $250 just by participating in this program. Now, since the $500 minimum is still in effect, if you're offering, say, a $250 bonus at the time a WisCaregiver is hired, you would still need to provide a $500 bonus to the WisCaregiver. Okay, so some more details on data tracking. Since we are a grant-funded program, data tracking is unfortunately part and parcel of everything we do, which is understandable. We have to be able to demonstrate to the department that the taxpayer funds we're using to train WisCaregivers actually results in jobs. That's where you all come in. Fortunately, our partnership with UW-Oshkosh makes this as simple and as easy as it can be. We will get into more details on how you will actually do this with screenshots and technical experts on the line when we do our implementation webinar this spring. But to give you a general idea of how this will work, we'll provide you with a link which will take you to the online survey. You'll enter the WisCaregiver's ID number and then click the appropriate boxes. Our goal is to make this as easy on you as possible and expect that this data tracking should only take a few minutes. And what you see on the screen here is the type of information that we're collecting. It's really basic and not anything too detailed. So benefits for your participation. The biggest program benefit is the source of pre-vetted and trained referrals. Having once been a recruiter, I know how difficult setting up these sourcing pipelines can be. And what this program offers you is a pre-packaged relationship model between each of you and your local FSET agencies. If you really develop these relationships, your local FSET vendors might even be able to help you source staff for other requisitions you may be running. Speaking more specifically on what we'll be providing our members, the main tool that we're providing to WisCaregivers and their FSET case managers is the online WisCaregiver map and employer contact list. This is where we direct our participants to look for work after completing training, so they will be funneled directly to you. Next, we are happy to share the CNA recruitment videos that I mentioned before with you so that you can use it on social media or your website. We can also put you in touch with the graphic designers who will be making the videos in case you'd like them to edit it to include your HR contact info or recruitment portal link. In this multimedia age where candidates expect information in easily digestible snippets. We hope that these videos can help you have fresh and shareable content to drive applicants to your door. Finally, we will be providing our employers a WisCaregiver training video, which you can use to help staff understand the roles and responsibilities of the program. Our aim here is to have easy to access content for new staff as positions turn over or as responsibilities shift from person to person. So here are your next steps. This is what you need to do to cement your participation in the employer consortium. After our webinar ends, a Zoom survey will show in your browser. You will have the option of saying yes, you want to participate, maybe you want more info before proceeding, or no, you do not want to participate at this time. We will use your answers to follow up with you. If you don't see the survey in your browser or don't have time to complete it today, we will also have the survey set up to be emailed to you tomorrow. If you don't get the survey or don't receive acknowledgement from us within the next week, please call or email me. The next steps of how this will work is I will use your survey answers to follow up with people who say yes or maybe. For those who say yes or maybe, I will send you our registration form. On that form, we're going to collect some information which will allow me to make sure to send the next step, which is terms and conditions, to the right person within your organization. That person might be someone involved like in HR, someone with the ability to hire, the administrator. It really is up to each employer to decide who should be the proper person to agree to these terms and conditions. But it's just someone, we're looking for someone who can commit to the retention bonuses and all the other terms and conditions. So after you complete your terms and conditions, and in order to agree to those, I will send you a link, another survey, which will list out every term and condition. You just click I accept for each one, and then that's it. You submit it, and then you are formally signed up. Then once you provide me your letter of commitment on the template, which we will provide, that's all the steps that you need to do in order to be officially signed up. And you'll just only have to look forward to our implementation webinar this spring in March or April. So with that, I think we have some time for questions and discussion. Again, I want to thank everybody for taking the time to meet with us today, and looking forward to having all of your participation.
Kate, just a couple of questions. If you said it already, I apologize, but how will people get access to the PowerPoint and recording after the session?
We will be sending that out to everybody. I will follow up as part of the follow-up with when I send out the registration survey. I will include the link to the recording online and the PowerPoint slides.
And then another question, when is the employer contract due by?
We're looking to wrap this up probably by the end of the year. So within the next month or so, we're looking to have everybody who signed up sign up.
And
but we're flexible and able to work with, so if you have a situation where someone's on medical leave, or we understand that our employer partners are dealing with a lot right now, and so we can be flexible to make this work for you. So again, I'm willing to work with you. So if you've got a time crunch and you're not able to do this right away, just let me know and I'll put you on my follow-up list for another day.
And another question, are the 74 hours of training all done online?
No, even the emergency nurse aid training program has clinical hour requirements. I believe it's 16 hours. So the 75 hours refers to the total number of hours that a CNA must be trained. And then within there are clinical versus classroom requirements. Now for the permanent nurse aid training program, I would not be able to speak knowledgeably about the split between clinical and classroom, but there are standards developed by the department for that.
And another question, after enrollment, when is the first date students can enroll?
So we're planning to launch our training slots in March or April, depending on how quickly we can get our computer upgrades finished.
And then another question, is there a fee for employers to sign up for this program?
No, this program is entirely free. The employers don't pay anything. The students do not pay anything. The trainers do not pay anything. This is a grant-funded program, and it does not cost anything. Although we appreciate that it would be valuable for our,
I guess
all of our.
the one cost is the agreement to pay the $500 retention bonus after 6 months.
That is correct. That is correct. So it is the nursing home's responsibility for that, but they don't have to pay anything to just be a part of the program.
There was a lot of questions that came in that I answered sort of individually for people. And so I'm hoping that I got everyone. And there was also some questions in the chat. I'm hoping we got all of those answered. So that was really great to see the interest and the good questions that everybody had. We'll do some follow-up with some people, but if you have further questions, please send it to either Kate or Robin on the slide here, and we'll get back to you as quickly as possible.
Yeah. Okay, great. Well, thank you so much, Kevin, for all your help with the Q&A box. And thank you everyone for attending today. Again, follow up with me through the end of webinar survey to let me know if you want to participate. And then I will be in touch with you for our next steps, our registration, our terms and conditions, and our letters of commitment. I really look forward to working with all of you. Thank you for the work that you do on behalf of our whole community and the hard work that you're doing. And with that, I'm going to sign off. Thank you to Kevin and Margaret and Robin for all your help and support. And again, thank you and goodbye.